So thank you so much for joining us for this session. And thank you to the organisers for having us present. So according to the most recent report from the UN on the stillbirth rate and numbers of stillbirths, what we've seen from 2021 data, which is the most recent report, which was reported last year, numbers of stillbirths have dropped to just below 2 million, so 1.9 million babies stillborn. That's at 28 weeks of pregnancy or later. Obviously, different countries have different systems for when they classify a baby's death before birth as a stillbirth. But for the international definition, from 28 weeks of pregnancy or later, almost 2 million babies were stillborn. So that's around one stillbirth every 16 seconds, and it translates to a rate of 13.9 stillbirths per 1,000 total births. And these rates really are understood to be an underestimate, as it's quite likely that stillbirths are being undercounted. But if you have a look at the graphs here, the one on the left shows stillbirths, the rate, the stillbirths per 1,000 total births, and you can see there is a downward trend, which is a heartening thing. And on the other side, the graph with the yellow shows the numbers of stillbirths that they have reduced slightly over the last 20 years. So that's encouraging, although still the numbers themselves remain unacceptably high. The figure 2 million can roll off the tongue quite easily, but in every instance, that's a mother and a family that are very often hugely impacted by this sort of event. What this report also reveals is that there's huge differences in stillbirth rates across the globe, with a risk that's 20 times higher in the country with the highest stillbirth rate compared to the country with the lowest stillbirth rate. So these events are not, the burden is not equally shared amongst different countries in the world. In fact, most stillbirths were concentrated in a few countries, with the greatest number found in India, followed by Pakistan, Nigeria, the Democratic Republic of the Congo, Ethiopia, and Bangladesh. And these 6 countries accounted for almost half of the estimated global number of stillbirths in just 6 countries. But they accounted for 36% of the global live births in 2021. So it's not just about population numbers, that the rate is very high indeed. And so there are great challenges ahead if we want to reduce these high numbers globally. So this graph here, also from the UN Group for Child Mortality Estimation, shows what could happen over the next 10 years. And the red line at the top there shows what stillbirth rates will look like between 2021 and 2030 if the numbers of stillbirths look like if the rates remain the same as they are today. So still a very unacceptably high number. The yellow line shows what stillbirth numbers might look like leading up to 2030 if the current trends are maintained. So if we continue to maintain that slight decrease that we have been seeing. However, the blue line shows what things could look like if we were able to reach the Every Newborn Action Plan targets for 2030. So the yellow line really is not considerably lower than the red line, and it would just be fantastic if we could see a genuine downward trend like that's shown in the blue line. And really, if you just imagine for a moment, if every mother and baby were able to experience a level of care and support during pregnancy and birth, that they could achieve rates equivalent to what is average in a high-income country, what we would see is that blue line down there, less than 500,000 stillbirths a year. And wouldn't that be amazing? So who or what is ISA and what are we doing about it? So the International Stillbirth Alliance, or ISA, is a global organisation that brings together bereaved parents, healthcare workers, and researchers to try to address the huge gaps in stillbirth and early neonatal death through collaboration and research, education, and advocacy. And ISA was founded 20 years ago now in 2003. We just had our 20-year anniversary celebration last year, by three US-based mothers of stillborn babies. And these mothers recognised that actually no country in the world was paying sufficient attention to stillbirth, or providing adequate support for bereaved parents and families, and they saw that it was a problem globally, and they intentionally decided to establish ISA as a global organisation to address stillbirth around the world. So 20 years later, ISA is an alliance of over 50 member organisations with individual supporters on every continent, and a board also that's very international. So this map here with these little location signs just shows where the board members are located. So I have to say it's can be tricky meeting. But since ISA was established, we've been instrumental in having the Lancet Stillbirth series published in 2011, and then a follow-up Lancet Stillbirth series in 2016. And both of these journal special issues highlighted the issue of stillbirth and offered a practical roadmap for eliminating stillbirth by 2030. However, we continue to face enormous barriers to realising these aspirations. So sadly, the focus on stillbirth is still missing at all levels. And so just to illustrate what I mean by that, if you note that just looking at these graphs, you'll see that one of the key just to explain what this graph is, one of the key interventions for improving maternal, perinatal, and neonatal survival is actually understanding the numbers of deaths and the causes of deaths. And that helps local healthcare systems to prepare and to develop strategies for reducing preventable deaths. But what we see within countries with policy for birth and death registration, only around 60% of countries have a system for registering stillbirths. And for those countries that do have systems in place for maternal and perinatal death and stillbirth registration, less than 60% are actually registering stillbirths. So this is a huge barrier to actually preventing stillbirths if you don't know how many are occurring and what the contributing factors might be. Another indicator that stillbirths continue to be under-prioritised is countries that have the small number of countries that have a target or a goal to reduce stillbirths. So just 31% of countries have a national stillbirth rate target, and really that's only a very small increase from 2016. So the graph on the right, that's all in red, shows that the numbers of countries with targets to reduce stillbirth rates have not gone up very much at all, but from 2016 to 2022. So clearly there is still a lot of work to do. So the ISA has come together to try and advance work in stillbirth prevention and to promote improvement in care and support for families who experience a stillbirth or neonatal death in the following ways. And this is how we work. Essentially, we seek partnerships on every continent to try and assist to implement our mission in preventing and ending preventable deaths and ensuring respectful care. And we work through collaboration by bringing clinicians, researchers, and parents together globally to share our knowledge, to share high quality data, and to promote efforts to reduce stillbirths. And so today on International Day of the Midwives, we'd really like to share some of the work that we've done, what we have done to help advance these goals. And there's some fantastic resources available that are free and easily adaptable to different country settings. And these include a global guide for stillbirth advocacy, that this can help different countries set up their own stillbirth advocacy. Advocacy toolkits for health providers and for parents. And the other thing that we've set up is an online registry of global registry of support organisations for parents who have experienced a stillbirth, or for those that want to become advocates for stillbirth. So this is what the Global Advocacy and Implementation Guide looks like. It's a lovely document. It's free. It's easy to access. If you want to scan the QR code, it will take you to the ISA website where you can download this. But I will take you through it a little bit. So the purpose of this guide was to bring together really existing technical resources and practical guidance and put it all in one place so that policymakers in different countries or healthcare providers that were setting up programs aimed at reducing stillbirths and improving care for women and families who experience stillbirth could go to one place and find good quality, easy to digest information to help them do that. And the target audience really was twofold. On the one level, we were thinking about national and subnational governments, civil registration authorities, health facility directors, and so on. And on another level, we were also ensuring that the material was able to be used by parents, parent organisations, community leaders, individual clinicians, midwives, doctors, and so on. So just to take you through a little bit of what these chapters look like, there's an excellent background section that really sets out what the toll of stillbirth is on those who experience a stillbirth, some of the underlying risk factors that are associated with stillbirth, just to increase awareness, particularly for healthcare providers. Chapter 2 goes through what the challenges are and what the opportunities are along the continuum of care to address those challenges, and an excellent section on bereavement care and just outlining in an evidence-based manner what some of the important elements are of respectful and supportive care for mothers and families who have experienced a stillbirth. And all of these include parent voice, community voice, and clinician voice. The remainder of the guide includes introduction to stillbirth advocacy for those who want to take up the advocacy challenge, how you might do that in your local area, and advice on how to implement programs, and also how to begin counting stillbirths and measure success. So all of the things that we know how to do in high-income settings, we've set them out in a very straightforward manner so that people that want to do this in their local setting can pick this up and go with it. So just to show you what some of the pages look like, it's not overly wordy or complex. Each of the pages has little stories, little quotes from clinicians, from mothers, and just information on what you can do on a practical level, whether it's care related, policy related, and so on. And lots of links to where you can get more information. So it's an excellent starting point also for students who are wanting to know more about care around perinatal death. So we would like to thank the funders for this, who gave us the opportunity to put this resource together, the Bill and Melinda Gates Foundation, and also to UNFPA for assisting with funding support for the design and layout. And also we would like to thank our partners, which includes the International Confederation of Midwives. So just that QR code again, in case you haven't had a chance. And I will now hand you over to my lovely colleague, Margaret Murphy, who is going to tell you about the advocacy toolkits and global registry.
Thank you very much, Billie. And just to, I suppose, reiterate, ISA's unique selling point is the connection and the relationship between parents and clinicians and researchers. And the advocacy toolkits were developed with parents at the core. And the purpose of the toolkits were to reduce stigma and strengthen bereavement care post stillbirth in countries that didn't have such resources available to them. And as Billie has already alluded to, two separate toolkits have been developed. The one on the left you see here, Raising Parents' Voices Advocacy Toolkit, is the Parents' Voices Toolkit, and that was developed and piloted with bereaved parents in Kenya. And the one on the right was specifically for healthcare providers, and that was piloted in India with healthcare providers and with parents. And when the toolkits were developed, the aim was that each toolkit can be further adapted for use in other settings. And the toolkits were launched in 2022 at the annual ISA conference in Utah. And they were both funded by PMNCH and by WHO, SEARO, for which we were very grateful at ISA. So the toolkit for parents, the first toolkit, is developed for stillbirth parent support organizations, and it was aimed to introduce the concept and aims of advocacy related to stillbirth, and also to provide guidance and to support parents to learn about how to raise their voices to help ensure their views and needs are heard within their country's health goal-setting agendas. And of course, the best way of doing that was learning from other parents. And the parent voice is very, very important. And so using the experience of other parent voices was very important within the development of these toolkits. And this toolkit includes information on stillbirth itself, the causes and the overviews and the risk factors, the impact of stillbirth on parents, advocacy as a tool for change in stillbirth prevention, and ways of advocating for change in stillbirth prevention and bereavement care, and coping strategies for advocacy-related stress. Excuse me. The toolkit for healthcare providers, again, is about raising awareness and educating women and their families about stillbirth so that we can advocate for increased resources for stillbirth bereavement support and to amplify the voices and the needs for stillbirth bereavement support, and to amplify the voices and needs of affected parents with fellow providers related to stillbirth bereavement support. And this awareness is still limited in many settings. And communication between parents and clinicians is a necessary step in ultimately supporting parents to advocate for stillbirth prevention and bereavement support. So the next step we would hope would be the implementation phase at the country level, because at many parents would tell us that the respectful care at the time of loss is still a challenging issue for them when their babies have died. So delivering news, acknowledging parents' grief, talking with parents about how their baby may have died, making room for them to express their need for support, even encouraging them to meet and to hold their babies, can be challenging for many, many parents. Discussing a safe plan for future pregnancies, providing respectful bereavement care can be very, very challenging. So those kinds of issues need to be developed, and they need to be culturally appropriate. Not every culture will have the same cultural needs, and so that's why the parents' voices are so important in terms of leading the way. Thank you, Billie. The third part is that Billie spoke about is the global registry, and the global registry is a very important, again, free area of stillbirth support that was developed by ISA to address gaps in respectful bereavement care by identifying organisations or individuals that provide support to parents and families following stillbirth. And to do that, the ISA developed a free resource whereby organisations can self-nominate or essentially just register themselves so that they can be identified on the registry as a resource for parents, but also as a resource for other clinicians. It can be, again, you can see the link there to the Stillbirth Alliance registry map, because there are challenges for clinicians, and there are certain parts of the world that are poorly supported in terms of stillbirth support. So, and that was very clear when people started to self-nominate onto the stillbirth registry. You can see that even from the screenshot there of the map, there were certain areas of the globe that were well supported, and certain areas of the globe that were poorly supported. So we're still encouraging people to come and join the free global registry. So if you're interested in your part of the world, I would encourage you to join, to come onto the ISA website to join the ISA registry. It doesn't cost any. There's no cost, and you may identify other like-minded individuals. You may end up identifying people of support in your area. So once the registry was up and running, as part of ISA, we decided we would do an online and snowball search of support that was provided by those individuals and groups that had registered with the registry. And we did an online survey and in-depth interviews with a subset of providers to really understand the challenges that they face and how these could be overcome. And what we found was the main findings, and these may not be a surprise to midwives working, in the area, were things like stigma. Stigma was still identified as a real challenge across all regions of the world. The funding gap was frequently reported. Factors affecting the reach of support. So these were things like language, transport, referral systems. A lack of awareness of stillbirth at policy level. So that meant more training and education for healthcare workers, was needed. And challenges with workforce, midwives and obstetricians were often overworked or overburdened. And, particularly peer support and supervision and training was needed on how to deal with grief and loss and bereavement. And there was a poor lack of advocacy, particularly partnership and advocacy training. And of course, this is where the toolkits would really be beneficial. So potential solutions are available. And investments in these solutions are now available to address the barriers and reduce inequalities across the globe. So what did the Global Registry also tell us? Well, there were many supporters identified, 621 support providers across 75 countries, 510 organisations, 111 point persons, but big gaps in high burden settings. So in the 6 countries that Billie identified with the highest stillbirth burden, we found only 8 support providers, 6 in India, 2 in Nigeria, none in China, Ethiopia, Pakistan, or in the Democratic Republic of the Congo. So we need to get the word out there, I suppose. Perhaps there are support organisations out there, but maybe just the word isn't getting out there. The registry is live now on the ISA website, and it allows anyone in the world to identify the nearest stillbirth support organisation or stillbirth support point person in countries where there are no listed organisations. So if you are a representative of such an organisation, we hope that you will join the registry. There's no fee at all for joining, and access to the registry is free for all. Unsurprisingly, the largest number of support organisations was identified in the USA and across Europe, but we hope to change that. The registry is an interactive map. It's still undergoing tweaking and improvements, but it's available. So if you are a support organisation and not part of the registry, please do contact us at registry@stillbirthalliance.org. And all information is on our website at stillbirthalliance.org. You can find out about all of these products and about everything else we do. And do consider joining us as a member as well. There's free membership for people who are, living in countries where funding may be an issue. So we look forward to many of you joining our alliance, and we just want to thank VIDM for having us here today. Thank you very much.